More than 1 year has passed since we began living with and adjusting to the COVID-19 pandemic. The COVID-19 pandemic has put a halt to activities at markets, terminals, schools, public health centers, places of worship, businesses, and factories, as the government encourages studying, working, and worshiping at home. However, the new normal policy or adoption of new habits is being promoted to help restore the economy while continuing to implement health protocols. Public places and health facilities are back to actively providing service to the public, while continuing to improve safety, comfort, and cleanliness. A non-profit organization from the Netherlands, SNV, is implementing the Hygiene and Behaviour Change Coalition, HBCC, a program that focuses on hygiene and behavior change, improving personal and environmental hygiene to contribute to the prevention of COVID-19 through 3 approaches, namely increasing public awareness through mass media, behavior change campaigns at the district or city level, and behavior change using digital media. The main targets of the program are school students, cleaners, groups of people with disabilities, and users of health and public facilities. Funded by the Government of the United Kingdom and Unilever, since September 2020, the HBCC program has been implemented in more than 100 schools and madrasas, 119 health centers, markets and terminal. It has reached 7.5 million people, including women, children, youth, cleaners and people with disabilities, through collaboration with the local government, civil society organizations, and regional apparatus organizations. The design of the HBCC program began with a formative research that aimed to construct a campaign with the right focus, the right target audience, the right message, the right channel, the right agents of change, and the right motivation. The results of this formative research became the basis for the strategic design of the HBCC program. Within 11 months of implementation, the HBCC program has reached more than 20 million people, increasing public knowledge and awareness through mass media such as TV, radio, posters, billboards, Videotron, nudges and digital media such as YouTube, the WhatsApp messaging application, social media apps Facebook, Instagram, TikTok, and the website www.tongapcovid.id. We modified the materials to improve audiovisual accessibility, so that it can reach wider audiences and be more inclusive. We increased the color contrast, changed the placing of text in posters, and provided a sign language interpreter or subtitles in each video. The midterm survey showed that 61% of respondents in 10 districts and cities were able to mention key messages related to the 5-star health protocol, and 69% of respondents in markets and terminals were also able to mention crucial times to wash hands with soap. Behavior change campaigns at the district-city level were carried out in schools, health centers, markets and terminals, using the School of 5 campaign, 5-star campaign and training for cleaners. Throughout the program period, SNV involved and cooperated with the Health Office, Education Office, Trade Office and Transportation Office. The School of 5 approach used 5 superheroes in its efforts to raise awareness and change the behavior of students at primary schools, madrasas, and schools for disabled children, in maintaining cleanliness and implementing 3M to prevent COVID-19. Conducted both online and offline, the School of 5 approach encourages behavioral change through stages of awareness, commitment, reinforcement, reward, and outcome. This School of 5 approach was based from research on behavioral change in school-aged children in forming a lifetime habit. Before dissemination, the key messages were well tested to ensure that they matched perfectly with the target audience and could be well received. To reach a wider audience, all School of Five materials may be accessed and downloaded through the Tonga PCOvid.id website. The School of Five approach, which was conducted from December 2020 to March 2021, has inspired many schools to replicate the program. The 5 Stars campaign represents the 3M behavior: wash hands using soap, wear a mask, maintain distance with others, clean surfaces, disinfect. Also accessibility. It aims to turn all assisted health and public facilities into 5-star facilities. The campaign went through many steps, starting from training of the management and cleaners, establishment of entry protocols, routine cleaning of surfaces, dissemination of communication, information and educational materials, and reminders or nudges to follow the 3M behaviors. In the 5 Stars campaign, SNV, in cooperation with local governments, has designed and established more than 170 inclusive handwashing with soap facilities, which were distributed to schools, markets, transport stations, and community health centers. The process of establishing these CTPS facilities was done in collaboration with persons with disabilities to ensure that every feature could be accessed by all. The HBCC program also pays special attention to cleaners, who also play an important role in preventing the spread of infectious diseases caused by bacteria or viruses such as COVID-19. SNV believes in addition to doctors, nurses, and other medical personnel, cleaners are also frontliners in the provision of public health services. To support these cleaners, SNV, in cooperation with health offices, industry and trade offices, transportation offices and education offices, has provided training for cleaners working in public and health facilities such as terminals, markets, public health centers and schools. In this training, cleaners were educated on practicing protective measures such as proper handwashing techniques, using personal protective equipment, PPE, and also hygiene and waste management.
Alhamdulillah, masalah prokes kesehatan ini kami tahu dari SNV dan dari Dinas Kesehatan. Bahkan kami juga dibantu masalah peralatan, yaitu alat kebersihan. Terus yang kedua, kami dibantu juga tempat cuci tangan, kacamata, kaos tangan, dan sepatu untuk pelindung diri dalam rangka kebersihan di masa pandemi.
Public and health facilities that are clean and follow health protocols will make visitors and workers feel safe at the facilities. Since December 2020, the HBCC program has trained 1,280 janitors at 55 markets, 51 community health centers, 13 terminals, and 100 schools spread across 10 regencies cities in Java and West Nusa Tenggara. The HBCC program has been adopted by many other local governments, proving that anyone can provide health and public facilities that are inclusive and in accordance with standards for preventing the spread of COVID-19.